you're putting something foreign in your body, right? And that's the whole thing of it. If something's not meant to be in the body will react.
Yes.
You know, and obviously in some people it doesn't affect them as much. Or, you know, I question whether they have literally no effects. I question that. There could be just some sort of underlying mild things that are going on that they just think are niggly, they don't correlate. But you're putting something foreign in your body. The immune system is there for a reason. It's to stop, you know, anything foreign. It's just to, so therefore is an issue right there. So the body will react.
You've got to actually consider these health effects because there are health effects. We now know this if you're considering this type of procedure.
Hey guys, welcome to the ATP Project. You're with your hosts, Steve and Nick. Hey, Steve.
Hey, I'm excited today.
Yeah, we've got a good one. So we actually have got one that has been done in the past, but it doesn't exist anymore.
Years ago.
An episode that was done in the past. So we've had some people ask about this, so we thought we'd redo it.
This is a good one.
Yeah. So
it's fascinating.
All about breast implant illness today.
BII.
BII, yeah.
And it's also called Asia, Asia syndrome.
Asia syndrome.
And I mean, that's nothing to do with the country Asia. It's just it means something adjunct stuff. But we'll talk about that. So breast implants. Now, I was very surprised when I was researching this about the when did they start? When did the FDA first approve this in America?
1962.
So we're only talking like, 62 years.
Yeah.
Is that right? Yeah, I hope so. Yeah, it is 62 years.
Yeah.
Now what blew me away, now we've just got USA figures here.
Yeah, so we only got, I really struggled to find, I think the figures in Australia, some I saw were 12,000 breast augmentation operations a year in Australia.
Oh, wow.
But I think that's a little bit older data, but I really struggled to find up-to-date data.
My wife's a nurse and knows a lot of women that have had these, and one of her best friends has just had these about a year or two ago now. So very interesting. Now in America, what are the figures? One in how many?
1 in 26. Women have breast implants, just blows my mind.
Oh,
they're still doing them a lot.
Oh, yeah. I mean, how many a year are done in the States then?
300,000. 300,000 breast augmentations a year. And we don't know if we break down whether some of it is reconstruction, possibly. Yeah. Maybe not be all aesthetics. But yes, 99% of procedures performed on women and 1% on transgender people.
Yeah, I was just waiting. I'm glad you said that. It's like, because I thought 99% on women, 1% on men.
Yeah.
But it's not. No. Although I have seen men with
pec implants.
Yeah.
And we can talk a little bit about that because we're going to talk about obviously breast implants, but really this applies to anything that's in your body that's foreign, really, because your body can have the same reaction to anything that you put in your body. So whether it be implants, whether it be medical devices, whether it be you can get, those body modification things, silicone things that people stick under their skin now. So
not under your head, really?
Well, anywhere, spiders,
I've seen it in the head.
Horns, the whole thing. I don't know. There's a guy that had horns. Yeah, I don't know.
I know you can get for men downstairs department enlargements.
Yeah, I think that's different, Steve.
Is it?
Yeah, I think that's different.
Oh,
it's a different procedure.
Yeah, it's a very painful one. It hurts, so don't. I'm joking. Anyway. I know. I get in trouble. Emails to Nick. So it's all right. So 99% of these procedures, but there's 1% performed on transgender people. That's a politically correct way of saying it. Okay, so if you want to change, but it doesn't really matter because once it's in the body, you can have calf implants, you get bicep implants.
Buttock implants are quite popular now.
What's that one?
Matt's laughing in the corner.
It's
true. Buttock implants are also very popular. Popularised by a particular family in the US, I guess, maybe back in the day.
Who's that?
Oh, Steve.
I
can't say it. The Kardashians.
Oh, right. Okay, I didn't know. I don't watch I know there's a Kim Kardashian.
Yeah,
there's more than one.
Hey, I don't want to judge. I don't want to stipulate with that she had buttock implants or not.
So what is BII?
So it's called different things. So it's also been called silicone incompatibility syndrome, silicon toxicity syndrome, and ASIA, which is autoimmune anti-inflammatory syndromes induced by adjuvants. So there's a mouthful.
I'm glad you wrote that because I can't remember that. I know it's called ASIA syndrome, but it's quite common, and I've got some big papers on that. So when you want, we can talk about that, but we're getting to the symptoms and all that sort of stuff. Yeah. I've got some papers here too, just for people who are listening. Got 4 great papers here. One of them is called Breast Implants, Common Questions and Answers. Really interesting.
How's that? I didn't see that paper. You didn't give me that
No,
paper.
I didn't give it to you because there's some graphic. I didn't want to give you this picture because it's a little bit not G-rated.
Oh.
Do you want me to show you? And I'll just show you.
I did see it, yeah.
It's where they do the incisions, and I didn't know if it was appropriate to send you a photo like that because I'd be in charge with HR. I'll be. But yeah, they do incisions, and there's a few different places you can do it, and I'll do it on myself. So if you're watching, they cut under the breast is one of the more common things and insert that way, or they cut the nipple. If you need a nipple rise, and you can put the small implant in there and feed it in. You can do it under the arm here.
Yeah.
And you can also, now they're doing it from the umbilical cord. And inserting it that way, yeah.
Wow, so and you can go under the muscle, you can go over the muscle. There's so many different
Look, there's
ways.
the incision. If you can see the bottom one there, I'll keep it away
right
from
near
the camera.
belly button, navel,
umbilical
area.
Umbilical cord, yeah.
Yeah, wow.
So very interesting, and we are mainly focusing on some of the side effects today with the silicone implants, but there is also some side effects that occur from the actual surgery too that are not to do with the silicone, just to do with the actual surgery. And again, I've got photos here, but they're graphic, and so I can't really share them. But I'll show you, and you can. Jesus, you can get asymmetry.
Oh yes.
Nipple problems, and you can lose your nipple totally.
Yes, I have seen that before. Well, not seen it with my own eyes, but you can lose a nipple and stop a mass laughing.
I don't want to comment on any of this.
No, but you can. The nipple can die. In surgery, after surgery. We're not here to talk about why should you or shouldn't you. No. We're just here to talk about what can happen to some women that can end up with a lot of issues, and it can, go back to the breast implants.
I know, and the symptoms are amazingly varied, is what I found in the papers.
A lot of symptoms.
I've got some. I think it's in this one. Oh, it's probably not in this one. It's probably another one over there. They're all the symptoms that occur, and here they are. Good. But we'll go through them one at a time here, and I'll tell you the percentages. I'm just showing a graph here of the symptoms that you've listed here.
Oh, amazing.
Which is absolutely amazing.
Yeah. Okay.
So you want to go through the first one?
Fatigue and chronic fatigue syndrome even can be very common.
That's very, very common. And it's represented here as brain fog and fatigue and all that, and that's the majority of the symptoms, which is, to me, was surprising because I thought, okay, it would be uncomfortable. You might get a sore back because your weight's distributed differently. But it was none of that. It was to do with the brain.
Yeah.
Which is like, that's a weird thing because I imagine that most of these women would be getting it for aesthetic reasons, to look better. And I thought if you look better, you would feel better. But they feel worse.
Yes.
Because of physiological reasons.
Yeah.
So it's not like you feel bad because you lost an arm or something that's terrible. This is, this is really interesting. And the second symptom of brain fog too.
Brain fog. Yep. A lot of cognitive issues.
Yep.
Also depression, anxiety, memory loss, all that sort of thing, headache. So a lot of sort of neurological type issues.
22%, I'm rounding the figures off, 22% of women that get breast implants that reported side effects were psychiatric depression. And so that's incredibly common.
Yeah, really, really common. Insomnia.
Oh, insomnia.
Really common. Joint and muscle pain, again, actually really common. Do you have stats and percentages of that joint and muscle pain on that one, Steve?
Yeah, there is. There's loads of it. There's lots of it. Yeah. The biggest one is, believe it or not, difficulty breathing, which is a bit weird. I guess that's the physical weight again, maybe. Sore aching joints, here it is. It's 13% of people that report side effects. Yeah. That's one of them.
Yeah, right.
And these are the chief complaints, the primary complaints. There's secondary complaints too. Yeah. So these are just the primary complaints.
Yeah. Well, I'll keep going because I've got a massive list. So vertigo, limb numbness or tingling. Yep. POTS, postural orthostatic tachycardia syndrome. So when you stand up, your heart races, that type of thing. Yeah. Muscle weakness, hair loss, rashes, light and sound sensitivity, visual disturbances, painful subcutaneous nodules. We did the cognitive stuff. Weight gain or weight loss, post-physical and cognitive exertion malaise, sleep disturbances, dry eyes, dry mouth, new onset Raynaud's, chemical sensitivities, atopic or allergic symptoms, multiple chemical sensitivities, immunodeficiency, GI issues, pain, heart palpitations, interstitial cystitis. There is so many. And this is where it becomes a problem because there's such a vast range of symptoms and every woman may get different symptoms. It makes it very hard to take it back to the implants being the cause of this.
Yeah, I mean, if you get, I'm picking one out here, random GI issues, how do we know that's to do with the implants?
Exactly.
There is a study that actually has looked at, and this study here is when they've actually, what's happened to their symptoms after they've removed the breast, because breast removal, and we'll talk about that a bit later in detail, but it's a huge industry. My mate who was best man at my wedding, his brother's wife had her breast removed a few weeks ago.
Okay.
So it's like...
implants removed.
Implants, yes, I'm sorry, implants removed. And, they're only in there maybe 5-10 years.
Yeah, well, that's the thing. And there is some studies, and again, this is why it's so difficult, and took such a long time to even get recognition that it was breast implants that were causing a lot of these issues. So a lot of studies show that the onset of symptoms can happen 6 to 10 years after the implants for a lot of women. So how do you go 6 years later? Well, it's your implants, because they're going, well, I was fine for 6 years, I was fine for 10 years, and suddenly all this stuff's happening.
You wouldn't blame them initially, would you?
No, you wouldn't. You'd be looking elsewhere.
A year after surgery, the pain's cleared up and everything's sort of scars minimised now. So you're back to, quote, normal, and you should be theoretically the size you want, and so you're happier with your life because you've got a happier body, and you should be having less of these symptoms.
Yeah.
I mean, but weird ones like Raynaud's. And you said dry eyes, dry mouth. There's a syndrome called Sjogren's syndrome, which is an autoimmune disease of the salivary glands and other organs, and you get dry eyes, dry mouth, dry nose, dry salivary glands, dry downstairs for ladies, and it's incredibly damaging.
Yeah. A lot of presentation of autoimmune conditions, Hashimoto's, rheumatoid arthritis, Sjogren's, as you said. There's a lot of autoimmune conditions presentations. I mean, I've seen quite a few clients that with breast implant illness over the years.
Oh, have you?
Yeah, quite a few. So, and that's the thing. So, up to 10 years later, you can start to get, issues. So that's what makes it really hard to prove that it is the breast implants. I usually say to people, obviously, when you say when did things start to change? But in this case, they said, well, it's not the implants because I got them 10 years ago, and it's only just started in the last 6 months.
Which is tricky. I mean, I was talking with a staff member today about the onset of symptoms, and we were talking about influenza A, so it's a different topic. And it's got a very short onset, it's about 1 to 4 days at the most, 2 or 3 days. She said, oh, yeah, Friday, blah, 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 and then Monday we were all sick, and it's like, yeah, that's typical for an influenza A. In COVID's about 5 to 7 days, a bit longer. But so this is dangerous because, if you hypothetically had breast surgery and you were pain and something drastic happened to you, you go, oh, that's it, and we take them out and reverse it and all that sort of stuff.
Exactly.
You know how much the reversal procedure is for my friend? I've got
I don't know.
$18,000.
Wow.
Yeah,
is
everything.
it covered by Medicare here? No?
I don't think so.
Oh, okay. Wow.
Because breast implants aren't, are
Well,
they?
no. How much is the implants?
Well,
I wouldn't even. I should have looked
from a case study of one that I know of, $14,000.
Okay, and then they can do them overseas for less.
Yeah,
like Thailand and that sort of thing. Other countries
do everything
which then
overseas.
creates a whole other set of issues.
I
Sometimes.
know. Right. So some of the symptoms you've got here too. Raynaud's. I mean, Raynaud's is when you get cold fingertips and the poor circulation there. I can't make the link between breast implants and Raynaud's.
Yeah. I got diagnosed with Raynaud's years ago. No, I had Raynaud's and I got told I had lupus. That's from a doctor. I didn't have lupus, which is an autoimmune condition. Because I had Raynaud's, I apparently had lupus because Raynaud's can be a symptom of lupus.
It can be, yeah. Lupus is usually associated with autonuclear antibodies and other symptoms. Your kidney things, skin, you get the butterfly rash and all that. You didn't have any of that, did you?
No, I didn't have it. So I just thought it was hilarious that the doctor said I've had an autoimmune condition. I didn't.
Lupus usually affects women.
Yes. No, I 100% do not have lupus.
How's your Raynaud's?
No, it cleared up. I moved to Queensland, gone.
Oh,
it went away.
Bloody Victoria, it's freezing cold down there.
Yeah.
Anyway. It's funny, I was talking to a rep this morning on the phone. He's in Melbourne. He was at pains to say, it's sunny here, it's sunny here. It's like, oh, wow, winter's sunny in Melbourne. It's like,
No, it does get sunny in Melbourne.
It does. It's great.
It's terrible. Melbourne can get to 46 and 47 in Melbourne.
I remember those days.
Did you want to take 2 days? But anyway, we digress.
Absolutely. So all right. So we'll get this difficult delay, which is a problem because like viruses, I was saying before, if you get a virus and then you get sick within 2 minutes, you know where it came from and who gave it to you.
Yeah.
But 6 to 10 years later, that's ludicrous because you wake up and you got Raynaud's or you're starting to get some pain or just feeling foggy in the head. It's like, where's that coming from?
Yeah.
And it's incredible. And it's like, you know, I've got a paper here where they've followed up people, a cohort study, which is follow-up of people. And this is called Breast Implant Illness Cohort Study. It's published 2023 and it's published in Curious, which is a beautiful paper, where they actually got the implants and then they took them out again. I've got a picture of a removed implant.
Yeah.
Do we want to see? Can we put a trigger warning or anything like that? It's not it's a bit of a graphic. There you go.
Yeah. Look at that. So it's looks like some type of, we will talk about biofilms.
Yeah, we will talk about biofilm.
Yeah.
So this is quite interesting and the implant has been like attacked by the immune system. It looks like there, and it's quite graphic if you're listening at home. But there's studies where they've taken, for example, and I'll just open up the page to the top one here, where, okay, you said brain fog. How many people get this and all this sort of stuff? That during brain fog, 4.1% of people suffer symptoms of it. If they believe it's the breast, they take the breasts out. Post-operative score drops from 4.1 to 2.2.
So halves.
So it halves. And most of these things are halved. Aching joints, 4.1 to 2.1, half.
Wow.
Numbness and tingling arm, legs, 3.3 to 1.8, about half. It's almost every single symptom, from hair loss to other things, is pretty much halved. So,
and it's funny because I've seen the clients that I've seen over the years, I've had some that have their explant surgery and literally overnight their symptoms disappear.
Yeah.
And I've had others that a lot of their symptoms disappear, but then they may have an autoimmune condition that then continues. So different people have different experiences, but a lot of the times, yes, a lot of women can have the symptoms disappear.
Yeah,
some
they
literally
do.
Overnight. They wake up from surgery and some of the symptoms are gone.
It's absolutely incredible, you know. It's like, and they're looking at studies here of the objective scores and all that sort of stuff, and they're all dropping. It's absolutely incredible, and you know so with you can't have with correlation and causation. It's a bit of a tricky science thing, but correlation doesn't mean causation. So if you get breast implants and then you get brain fog, it doesn't mean it caused it, but it could be.
Yeah.
Okay, and the way to check that is to have them removed and see what happens.
And that's it, and we'll talk about how you can do this, but how you can fix it. But it is the only way is to take them out. And look, there are so many women that get them that don't have any issues. So,
all right.
And we'll talk about reasons why you may have issues. But the problem with this is there's really no tests for it.
Well, that's my next question is how do you test? And there's no specific test.
There's no specific test.
And this is like, I think this may be a diagnosis of exclusion.
Yeah.
And this is where this means you can't just get a test. You've got to say, okay, when did you get the brain fog? Oh, you know, about 5 years after I got the breast implants. Have you looked at anything else? You rule out this, you rule out that, you test for everything else. And then it may be, and in about 50% of cases, according to studies, it may be breast implants, but it may not be.
Yeah, that's right.
So you could quite conceivably have your breasts out and your brain fog remains.
Yeah.
I mean, this is a bit scary because
it is.
I mean, how do you really don't know.
You don't. And like a lot of the bloods will come back normal. A lot of the inflammatory markers will come back normal.
Yeah.
So you can test for ANA, so anti-nuclear antibodies. Sometimes they can show up other antibodies to specific autoimmune conditions like your lupus and your Sjogren's syndrome, rheumatoid arthritis, that type of thing. But not always. Don't always come up, so which makes it even harder.
Okay, let's say you've got a definitive test that you got Sjogren's. And it's like, now you could get Sjogren's just an autoimmune disease, or it could be because of your breasts.
Yeah.
So you and then you might get your breast removed and the Sjogren's is there because it was caused by something else.
Yeah.
This is tricky. This is really you have to think about this one. Yeah. This one's because there's, we'd love to give you the definitive answers. And I know we're talking about cholesterol here a couple of weeks ago, and we had nice answers. There were studies that showed this, showed that. This one's a grey area. So do you want to sort of talk about some of the issues surrounding BII as an actual condition? Like what are some of the studies say on that?
Yeah, so as we said earlier, it was very difficult to have this recognised as an actual condition because of all these factors, because the onset of symptoms can be so much further away from the actual initial surgery. All the different types of symptoms are completely different, that type of thing. So so there was a lot of studies done from, the late 90s to 2017 to find links between implants and systemic illness. There
was a big meta-analysis done in 2000.
Yeah.
Do you want to talk about New England Journal of Medicine? So a big paper. Do you want to talk about that? Janowski's paper?
Yep. So they found no association between implants and various autoimmune conditions.
Okay, so let's just that's a good piece of evidence.
Yeah. Yeah.
But I wonder how the methodology was.
Well, that's it.
Because how do you know?
How do you know? Exactly.
I mean, it's it's very difficult to figure that out.
Yeah.
Okay,
2011,
so let's fast forward.
There was an FDA review that said there was no evidence to link silicone breast implants with increased incidence of rheumatologic disease.
Okay, so if you're listening at home now and you're going, well, it's case is solved.
That's the science is settled.
The science is
settled.
Connection. Oh my God, that's saying the science is settled.
And so here are some of the problems with some of the studies.
Go for it.
So a lot of the patients with breast implant illness didn't meet the formal criteria for specific autoimmune or inflammatory conditions and diseases. Yep. So they didn't meet the criteria.
No.
Immune-mediated diseases are relatively uncommon. So that's also a factor. Delayed onset of symptoms, as we said, becomes a big problem as well. Autoantibodies can be present for up to 10 years prior to the onset, which we know with autoimmune conditions it can as well. You can have antibodies and have no presentation.
Yep.
So therefore doctors say you don't have an issue, which we've talked about previously. So there's so many factors involved in making it really difficult to sort of say, well, there is a connection.
So diffuse. If there was one condition, you could rule it down. I've got a paper here on one particular condition, which we haven't mentioned here, by the way, but it's a weird one, but absolutely incredible. It's just like it's very grey, this whole, But let's keep going through some of the studies. Let's fast forward to 2018.
Yeah.
What do we got there?
So now there's a bit newer data.
Yep.
So 2018, there was a study done of 100,000 patients with a 7-year follow-up and found increased incidence of several autoimmune conditions.
Which ones?
Including Sjogren's syndrome, rheumatoid arthritis and multiple sclerosis.
All three of them more common in women than men?
Yeah.
Women have more autoimmune disease than men, for those who are listening at home. But that's a better study. 7-year follow-up.
Yeah.
100,000 people. We're starting to get into more data.
Yeah, exactly.
So that year there was a few studies that came out. Any others that you want to talk about?
There was another one that's published in so this is Bulk et al. In 2018.
Yep.
So published a large meta-analysis using pooled data from 32 studies. So this study and 2 large review articles published in 2016, 2018 all found statistically significant increased incidence of autoimmune rheumatic disorders in women with silicone breast implants.
Wow. Okay.
So they were starting to see a little bit of a emergence of these, the connection there. Another one in 2018 showed increased risk for Sjogren's, scleroderma, and
sarcoidosis in women. Yeah. Oh, jeez.
And that and then so people were still saying, this doesn't make it conclusive. Well, nothing's conclusive, obviously, but I think we're starting to see some sort of connection coming out.
All right. So let's say a woman, hypothetical, let's say a woman suspects they're getting this from their breast implants. Is there any data on showing what happens when those breast implants are removed?
Yes. So a lot of them, there was a lot of symptomatic improvement once they had the explant surgery.
Yeah.
And so here is one that then is now the first sort of definitive showing that, yes, there is a connection between the implants and issues. So there is a type of cancer called anaplastic large cell lymphoma.
Oh, that's a baddie.
Yeah, so the first case was recorded in 1997.
All right.
And that was the one where they're starting to show that was actually a connection to the actual implant.
Right. And now has the TGA responded to that?
Yeah, so I pulled this from the TGA, which is Australian website, Therapeutic Goods Administration.
Sure, yep.
So breast implant associated cancer is a rare cancer of the immune system. It's not breast cancer as such, which forms from the cells in the breast. The cancer grows in the fluid around and the scar tissues that surrounds the implant. So it's a little bit different than actual breast cancer, but it's a cancer of the implant, I guess you could kind of say.
Yeah, I know what you mean.
So there's been cases of, for short, BIALCL for short, is the type
That's
of
short.
tumour, that can happen right after the operation and up to 37 years later.
Ooh.
Yeah. And the average time to diagnosis is within 8 years of the operation.
That's not a good time frame.
No, it's not a good time frame. So and this is where they've shown that all the reported cases, I think there might have been one or two of the smooth coated implants, but the majority of them are of the textured implants. Yeah. So they have like a rough surface, and that seems to be where this cancer is developing.
And they've made those implants like that to hold in place a bit better, so they're not moving around in the body a bit. So that's why they did that.
That's why they did that.
Okay.
And so they're the ones that where this cancer seems to be.
All right.
Worse.
So talk if you think this is a possibility, talk to your GP about getting a test done for that.
Yeah,
they can do all sorts of scans.
Definitely.
Really interesting.
Yeah, really interesting.
That is really interesting.
Yeah.
So with the textured implants, what happened in 2019 with them?
So in 2019, this association led to a multi-country ban of textured implants.
Wow.
And textured tissue expanders as well. So, because if you've seen what they do, they get an expanders, and so I think it's this one where they want large implants and they don't have a lot of skin. They expand the skin to allow the implant to go in.
Right, go on. Okay.
Yeah, so it's pretty.
It sounds just all very graphic to me. It's even at this point, and we're still got a bit more to talk about. We've got to actually consider these health effects because there are health effects. And we now know this if you're considering this type of procedure.
Yeah.
Now, it's up to the 99% women and the 1% other that get these things, but they're not there to sort of physically help you. It's not like an operation that you need to remove a tumour or something.
It's not. You can survive without them. I guess.
That's what I'm sort of saying.
Yeah, I mean, look, even and we won't go into the whole psychological side of it. We can touch on it at the end, but the psychological side, I guess, would be more for women who've had mastectomies, maybe have breast cancer and they want reconstruction. I can completely understand that. Yeah, because you want to feel full, complete, or whatever the reason. Some women with mastectomies don't, but some women do. So I can completely understand where they are coming from. I've never had implants, so I can't say what the driver is for that. But is it other issues going on, self-esteem issues, that type of thing. So yes. But in those cases, it's not generally life-saving surgery to get implants. So,
I mean, I've from a male point of view, I don't consider breast implants, but other surgeries to make you look good. I get it. I've never had, say something simple like liposuction even, but I get it. You've got this bit that won't move and, in half an hour it'll be in a jar sitting beside you. Yeah. That's not a bad, to me, I get that. I go, that's why that. And, my father-in-law now, Dr. Doug, is doing gastric sleeving on people who can't control their appetite, where they're literally putting a sleeve over the stomach and shrinking it down so you can't eat as much. Yeah. I sort of get that.
Oh, but sorry.
What did you...
I just banged the table.
You banged the table?
Yeah.
You funny girl. So I kind of get this whole thing. Like I do understand if you want to feel better about yourself, you get the lipo, you get the breast implants, you get whatever surgeries you want to make you feel yourself. But this one, like lipo, yes, there are side effects, there's surgical risks and all this sort of stuff. But this is sounding a bit more serious. You know, brain fog, you don't get that from lipo, and don't get Sjogren's from sucking fat off.
Yeah.
But it's interesting.
Yeah, it's interesting. I mean, you're putting something foreign in your body, right? And that's the whole thing of it. Like if something's not meant to be in the body will react.
Yes.
You know, and obviously in some people it doesn't affect them as much. Or, you know, I question whether they have literally no effects. I question that. There could be just some sort of underlying mild things that are going on that they just think are niggly, they don't correlate. But you're putting something foreign in your body. The immune system is there for a reason. It's to stop, you know, anything foreign. It's just so therefore is an issue right there. So the body will react. So, you know, and so I like I said, I don't have implants. I can't comment. I don't understand the drivers behind it. But if it's purely for aesthetic reasons and the other challenge I found over the years with clients that I've seen with this condition is not wanting to get them out, and actually not because they won't recognise that could well be the problem. And as we said, we're never going to know 100% until they're taken out. But, you know, everything points to that, but they refuse to have them removed. So some women would prefer, look, and I've seen some very sick women that will get them out.
Yeah.
But I've seen some women who are quite sick, but to the point where they're not willing to take them out. And so therefore you're looking at the other sort of coin and going, well, what is it that's blocking you from making sure your health is the priority over your aesthetics? So then there could be other factors going on there, psychological things, you know. So, but it's a big, you know, if you're going to think about this sort of thing, you got to think about what you're actually doing to your body. You're putting something foreign in there. You're putting something with which we can talk about. Plastics, you know, toxic plastics, sometimes heavy metals, that type of thing, and that does leach into creates micro tears, and then there's people say, well, my implant they don't rupture anymore, which they don't. They've changed it, so it'd be very rare for them to rupture. But the lining, the actual sleeve, is full of it's plastics, it's toxins, so you're still getting toxins from that. And we've talked so much about plastics and toxins and what it can do to your hormones and disruptors and things like that. Absolutely,
so. and this is what we've got to sort of balance out. Now, I'd say I'd hazard a guess, and looking at the data, I have to say most women don't have any symptoms.
Most probably don't. Yeah, most.
Or they're mild and they're not, and they're worth the aesthetics. You know what I mean? Like there is a payoff. You know, you just got to look at that sort of thing. But there has been some deaths occurred in Australia, not many, but you want to talk about that in Australia, about, you know, how many people have died in, say, the last decade? In the last decade there have been four women that have died from this particular lymphoma. Okay, so this is this lymphoma, this weird BIALCL thing. Okay, so you know, and fluid does accumulate around the breast tissue because it's foreign tissue. Yeah. So, you know, if you have any doubt that there's some sort of fluid building up there, you can get it checked, you can get it scanned, you can get the fluid drained and checked. Yeah. So if you really think this is your case, then absolutely, you know. So it is really interesting. And then remember, 95% of these cases occur in the first 14 years. Yeah. And there's a lot of women around with breasts sort of older than that. Is that the right way to put it? Well, I mean, and that's the other thing. Breast implants are not designed for life. They have to be changed. Yeah. So they have to be replaced. I think it's every 10 years. I could be wrong. It might be more now because maybe they've changed the technology. But I've had, you know, clients that have had breast implants in for 20, 25 years. I'm like, well, they're not designed to be in for that long. I said, well, they're fine, but I don't know. Are they? No, I don't know. Yeah, look, it's really tricky. Okay, so let's say you're a woman out there, you've had a breast implant, you've got no symptoms, everything's looking good. What are some of the causes of, you know, breast implant illness? And or I should say the risk factors? What are some of those? What do you look out for? So there is a genetic link for some women. So people with the HLA genotype, Steve-O, so don't ever get breast implants. I won't. I'm HLA-B27. But there's other HLA-B genotypes. So there's sort of certainly a genetic link. Yeah. So one man's food, another man's poison is similar for this sort of thing in women, of course.
Yeah, exactly.
What about polymorphisms? Anything
so
there?
different polymorphisms. So the MTHFR we've spoken about. We all know what that one is. COMT, CBS, GSH, SNPs. So anything that sort of impairs that detox pathway. So that can be a factor. So So there's immune mediated. So this can be a cause of it as well. So as we said, we know the immune system reacts because it's a foreign body in the body. So there's that immune connection as well.
Now, we mentioned before about biofilms. You want to talk about that for a bit?
So this is can be another cause. So infection of the implants leading to biofilm formation. So I think we've talked about biofilms before. We've talked about gut infections and things like that. So, or you'll get all these bacteria or these, microbes, and they will then create like a little house around themselves. It's like a shell. So that can be a factor. So lots of little communities live inside this shell, and this is one of the big things that can happen in breast implants is the bacteria and mold. They can grow mold on them.
Oh, wow.
Yeah, which is so scary because I don't know if we've ever done a podcast specifically on mold illness. They have.
We have. Okay. Matt, we have. So find that one. Go find that one. That's number whatever that Matt might know.
Yeah, it might be years ago.
Episode 220, Mouldy Madness.
And now Steve's banging the table. Mold can be, and I've seen when I've been doing research on this, pictures of women that the implants are taken out and they've covered in mold.
Oh, don't say that.
I can't even begin to think that you're walking around with that mold in you. So, really scary. So biofilms lead to chronic inflammation. It's very difficult to diagnose a. I keep doing this. I'm just doing that.
She's being very graphic on herself, just for those who are listening.
So really hard to diagnose and really hard to. You can't really get rid of it, really, if you've got a biofilm. So
it's awful, isn't it?
Yeah. So, and they generally, and this is the other thing, they generally aren't tested when they're explanted for any sort of infections or anything like that. A lot of them, obviously, and the pictures I've seen, horrendous. You can see it.
Yeah.
But some of them you can't. And if they're not tested and you don't know what's growing on it, then it's not going to help when you're trying to do treatment to sort of get yourself back on track. So if we know, okay, there was mold growing on those, we need to do a mold detox. We need to do, all that type of thing. So if you are looking at getting explant surgery, if you're having issues, get your implants tested when they're removed.
Yeah, it's a good idea.
See what's growing on them.
Because there'll be some of that still left in your body.
Exactly.
It's funny because my wife's friend who had breast implants about a year or two ago, she's going through MRIs at the moment because there's something wrong there.
Okay.
And I don't know what it is. Could be minor, could be the fluid that's benign, could be anything like that. But she's really worried about it.
Yeah.
And understandably.
Understandably.
And I remember her going through the procedure. She was on endone for, I think, 3 weeks.
Wow.
Endone is oral morphine for those.
Painkiller.
And she was on quite a hefty dose. Well, for me, it was hefty because you're having major surgery,
Yeah, I can't imagine it's going to feel good. Let me tell you. I mean, I watched Botched. I see them the next day.
You've watched Botched, have you?
I watch Botched all the time. You watch Botched?
I've never watched it.
Haven't you? It's fascinating.
And then there are breast, it's related to this?
Yeah, well, any sort of body modification. So, and it's usually plastic surgery that's gone wrong. So they've been botched. So therefore they go to these doctors to get fixed up. But it's fascinating because I look at it from a practitioner perspective and I see the amount of mental health.
Yeah.
These people that they're going to the extreme with their body modification. There's so much mental health stuff going on there, and they're willing to risk their lives with some of the things they're doing to look a certain way. And I don't mean to the extreme of a certain way. So anyway, but yeah.
Yeah, it's very interesting, isn't it?
It is, yeah.
Incredible.
Allergies, so allergies of the
good
implant,
old allergy, yeah.
Allergenic compounds in breast implants, so silicon, polyurethane, acellular dermal matrix. So these are what are in the actual implant. Yep. Heavy metal toxicity, which can be a bad one. And I've treated people.
That's a weird one. That's a weird one.
Yeah, silicon adjuvant disease.
Yep.
And chemicals, which we didn't list, but there's quite a few chemicals in the actual plastic and silicone itself. So they can all be possible causes of breast implant illness.
Because silicon's supposed to be benign and does nothing, doesn't transport anywhere. Have you got some data on, what happens if you test the lymph nodes of some of these people? What do you find?
Yeah. So 98.8%, this is scary, had silicon particles present in the tissues.
Oh, my goodness.
How scary is that?
So it's everyone, pretty much.
Pretty much everyone has had some type of silicon bleed, they call it, and it's in their part. And I tell you what, if you, again, botched.
Oh,
but I've seen,
I'm going to watch this show now.
Watch it. I find it fascinating. I look at it from a completely different angle. Like I like to look at I like to know the drivers of why people do things, right? Because I'm like studying human behaviour.
Yeah.
I love it. But some people that have botched when they've got silicon in their face and things like that, I get that. But once silicon gets into your tissues, it's almost impossible to get it out. And it can migrate and it can cause all sorts of problems. So if
they put silicon in your face.
Well, like what do they used to call it?
Cheek
back
fillers.
in the day, people used to, and if you go overseas and they do real dodgy brothers, they'll put silicon in there, and it's
yuck,
really bad.
Because you can use a hydroxy. Matt's laughing. I don't know. Dodgy brothers. Well, now you can get cheek fillers.
Yeah,
and because my wife had some, she wouldn't mind me saying that. I hope. Too late now. Screw you. But there was just hydroxyapatite, so it's something you can take orally as a tablet. You know, we used to sell it at the Metagenics days as a calcium supplement, so it's healthy for you. It's not silicon, and it just lasts about a year.
Yeah, I don't know. I don't think that really is silicon these days. But for pretty much nearly every single person, everyone that they tested, had the silicon present in the tissue, which to me is super scary.
Yeah.
So 86.6 had silicon particles outside the capsule, so surrounding the capsule, lymph nodes. Yeah, so silicon migration.
It's 9 in 10 people. Basically.
Yeah, exactly.
It's pretty much everyone. You could almost, that sort of thing.
Yeah.
Okay, so you mentioned the word adjunct there a bit. What is an adjunct and
so
what is
it's a chemical that drives the immune system to respond to an antigen.
Yes. All right. So adjuncts are things that stimulate the immune system. Silicon's one of them. So so it's very interesting, isn't it?
Yeah.
I mean, really interesting stuff. So we've gone. So we can't talk about that long.
Pathogens contain adjuvants which drive immune, and there are adjuvants in things that we get when we're children.
Yes, those things.
Everyone gets growing up. We can't say the word, but we all get those.
All right.
And this is another one. So silicon, polypropylene meshes and facial fillers may serve as immunoadjuvants in genetically predisposed people.
Yeah.
And so meshes, which is, and even for hernias, they do the mesh, things like that.
Well, there was a prolapse head mesh, shouldn't be a hand mesh, but in women where they had the meshes to hold up the uterus from uterine prolapse, that caused huge problems.
Yeah. Because again, there was
a big lawsuit about that too.
Really? Yeah.
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 So if you've ever had prolapse.
It's scary. Even people have stents.
Yeah.
In some people, the body can react in a negative way because it's a foreign body.
Yeah, literally. And a stent is something for those who are listening, is you go through the groin or the wrist and they put it inside a coronary artery and they sort of like if you imagine a balloon blowing up inside the coronary artery and it stays there and it just pushes the artery apart so you don't get a blockage in your coronary arteries.
Yeah.
My mother and father have both got stents in their hearts as we speak.
There you go. And obviously it's not something you can not have. You have to have it. But,
life-saving.
Could that be, and I've for some reason seeing a lot more cardiac patients. I don't know why all of a sudden heart issues, but
because I keep forgetting you're in practice, and that's what you mainly do. Nicole Brown, naturopathy, you see a lot of this stuff for yourself. You work many days a week doing this. Seeing patients, and you must see this sort of side of things and the complex side of things.
I've seen quite a few breast implant women with this breast implant illness.
Yep.
And obviously some of the ones I've seen, things don't resolve when they have the breast implants removed, which
that's sad, isn't
not
it?
everything resolves. Yeah. So some autoimmune conditions can continue on and things like that.
So, my friend. My friend's friend, basically, wife, who had this procedure, she was just having mental health problems. Keep it like that. And I saw her and she still had a drain in last time I saw her.
Oh, really?
Because you still bleed for days afterwards. Because, and so
she started having issues pretty much straight away.
No, it wasn't straight, like about 10 years, I think.
Right. So she had them taken out and she had the drains, you mean?
No, that was a couple of weeks ago. She had them taken out. So, I saw her then and, she was carrying me around. What the hell's going on here? And, she had a bag and everything. Looked quite confronting.
Looks funny.
Bloody fluid.
I would say, well, no, it looks horrendous.
Oh, horrendous! Yeah, I know. I thought from a distance, I thought it was a catheter. I'm thinking, what shit? Anyway, so very interesting, isn't it? It's like
yeah.
I mean, it's incredible, but not everyone gets this. This is the whole tricky thing. Now, you've got a big write-up here on Asia, which is a country in Northern Hemisphere, but it's not.
So this is where the autoimmune or autoinflammatory syndromes induced by adjuvants. This is what we're talking about adjuvants. How do you say it, Steve? Adjuvants.
Adjuvants.
Yeah, thank you.
Yeah. I don't know. I've heard people call it adjuvants.
Yeah, I've heard of adjuvants. Yeah, no.
It's
Adjuvants.
Just things that drive the immune system.
Yeah. So Asia is a synonym for immune-mediated breast implant illness, and other names are silicon incompatibility
and breast were
syndrome.
put in 1962. When was this thing discovered?
First described in the medical literature in 2011.
That's a little bit scary.
Yeah.
Because first breast implant was about 50 years before that.
Yeah, I know, right?
And it's like, 50 years later, what's this? This just popped up. And the earlier breast implants were quite, they were silicon.
Well, they were, the Dow Corning, we all know about the Dow Corning issues and things like that. So they were pretty bad initially.
They had problems then, didn't they?
They had a lot of
and so it's an umbrella term that's used to just basically breast implant illness and quite scary. There is one scary symptom of Asia, which is it got its own scientific paper here, which is quite incredible.
Yeah.
It's a rare cases, but what they've found now is you're getting squamous cell carcinoma from breast implant patients.
Wow.
Isn't that scary?
That is actually.
I better read the papers because people are going to. It's the International Journal of Molecular Sciences, and it was published in 2024, a systemic review, and it's a title. It's a big title. Sorry about this. From case reports and molecular insights, examining the outcomes of underlying mechanisms of squamous cell carcinoma in breast implant patients, a systemic review. So basically, what they're finding is these patients are getting squamous cell carcinomas, which is a type of skin cancer. There's three main types of skin cancer in Australia. You've got squamous cell, you've got basal cell, and you've got melanoma. Melanoma is the worst.
Yeah.
Squamous cell is probably the second worst, depending on who you all that sort of stuff. But they are finding data here on lots of it. And the conclusion basically reads that, is certainly problematic. They mentioned the other cancer in here, but this is one thing. Includes our understanding of BIASCC, another one, breast implant, blah, 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 squamous cell carcinoma remains in its early stages. So it's quite interesting that this has now popped up in the studies. It's squamous cell carcinoma.
Wow, that's terrible. Isn't it?
It's interesting. It's not interesting. It's kind of sad. I don't. This is really sad because at the time when Jane Smith gets her breast implants, this was not. This is brand new.
Yeah.
I mean, what are we going to find out in the next 50 years?
Well, that's it. That's the scary thing, isn't it? So, yeah. So Asia syndrome, it only occurs in genetically predisposed people.
Yep. And you've got your list of the genes here, which is HLA, DRB1 and DQBR, which is you can test for.
Yeah. Yeah.
So if you're worried about all this sort of stuff, do you do the testing in your clinic?
Yeah, I can do genetic testing. Yeah.
Oh, okay, good. Didn't know. Should have asked before the podcast, but too tough. It's really interesting. And so that would be very interesting to look up. Now you've got a beautiful chart here of all the breast implant illnesses, which go from the head to the hands to the eyes to the breast itself to the brain. Now you want to just go through some of these because one of them is called Alzheimer's light.
Yes. So Alzheimer's light.
Yeah, that's interesting, isn't it?
Yeah.
It just means you've just become forgetfulness and they're calling it Alzheimer's light.
Yeah. And I hadn't heard that term before.
No, I hadn't heard it until I read the paper going, that makes sense.
Yeah, no, it's kind of strange.
Quite interesting.
Yes, it's severe fatigue, as we said. So POTS, postural orthostatic tachycardia syndrome, which is POTS.
It means you get up and your heart starts racing.
Yeah, heart starts racing.
It's...
And some people can be to the point where they can't actually stand up. They have to lay back in a chair. That's how severe some people can get POTS. Really can be very severe. My wife's
heart races when she sees me come to bed at night.
I bet she does. I bet it does, Steve. I bet it does. Yeah. Probably like, oh no.
Yeah, no, he's going to hog the bed.
Yeah, exactly.
Terrible stuff.
But yeah, no, there's loads. As you said, so Raynaud's the Stroke-like symptoms.
That scared the hell out of me.
So vascular manifestations. So
a TIA is a transient ischemic attack. So you get basically blood flow restrictions in your brain. So lots of brain stuff going on here.
A lot of brain stuff, yeah. A lot of brain stuff going on. So, so elevated angiotensin converting enzyme.
God.
So mast cell activation syndrome, which is actually something that I've seen, which is the mast cell activation syndrome because of the breast implants. Decreased IgG with increased respiratory infections.
So it flattens your immune system for infections?
Definitely.
IgG, IgG2 is the ones that protect against viruses. So, geez.
Yeah, super. So there's two major criteria for Asia syndrome. So one major and two minor criteria. So major criteria is exposure to an adjuvant prior to symptom onset.
Okay, that makes sense.
Yeah.
Yep.
Unexplained symptoms, fatigue, cognitive dysfunction, muscle joint. We've talked about all the different.
So that unexplained, isn't that interesting?
Yeah, and here's another criteria, major criteria: removal of the inciting event results in improvement. So that's a criteria. If you have it out, then it gets better, then that's also a criteria.
Jeez, it's an $18,000 gamble.
Yeah, exactly.
Plus pain and all the other stuff.
No, yeah. And then minor criteria is autoantibodies that are present. So as you said, the HLA, so DRB1, DQB1. And then autoinflammatory issues, so mast cell activation syndrome, as we said, Sjogren's, multiple sclerosis. So there's some of the criteria for Asia syndrome.
Okay, so let's talk about explant surgery, which is the breast removal.
Yeah.
And so this is considered the treatment of choice. Have you got some stats on how many women improve once they remove their, let's say offending breasts at this stage because they're implants. Implants. Yeah, I keep saying that.
Keep saying that. 60 to 70% have improvement after explantation.
Wow.
Which is pretty significant.
And it says here 95% of women improve, feel better as well. They get this, so that's quite incredible too. There's lots of different studies on this, but that's over 50%.
Yes, exactly. Yeah, it's crazy. So as we said earlier, some people feel better straight away, and others it takes a little bit longer to start to feel a little bit better. But this is another interesting thing. The longer you've had the implants, the less likely that you'll have improvement, complete dissolution of your symptoms after explant surgery. So if you've had them for 30 years, you may be less likely to have a resolution of your symptoms than someone who may have had them for 10 years, possibly.
That's terrible.
Yeah.
Because, it's taken you years to figure out and go through the medical models and all trying to figure out what's wrong with you.
That's it, yeah, unless you have significant, and as we said, sometimes it can be 10 years before you even see the symptoms. And then you might be another 10 years trying to figure out what they are, like what's causing it possibly,
And then if you make the decision, you've got to have the money there.
Yeah.
And it's $18,000. The only one I know. It could be less some places, more the others. Because, unfortunately, the woman I'm speaking of had to have some reconstruction because there was... it's just
and that's part of it. There has to be reconstruction because particularly if you had maybe larger breast implants, there's a lot of skin, a stretching.
Yes.
So you have to, there is that reconstruction side of it. So there's different types of explantation, Steve.
Go for it. What are some of them?
This is what I looked up. So en-bloc explantation.
Oh, what the hell's that?
So this is the capsule tissues left. So when you have a breast implant, there's a capsule around it, and that's one way the body tries to isolate it from the rest of the body to keep it to stop any sort of issues. So the capsule tissue is left intact in the breast implant, and the capsule and implant is removed as one unit.
Yep.
So a diagnosis of ALCL, which we talked about before, necessitates en-bloc explantation. So that's one type.
Yep.
And then you can also have explant with total capsulectomy.
Okay,
so they take the capsule and everything.
The entire thing
which
out.
I think I'd probably want to get done. I'd think I'd take the whole thing out.
Don't like that. Yeah.
Partial capsulectomy, so they take part of the capsule. And then an open capsulectomy, it's very hard to say. Capsule or scar tissue surrounding the implant is released surgically and left in the patient. So there's some different ways to take different types of explant surgery.
It's very scary because under the term treatment, Yeah, you want to go through that because that's sad. That's one.
This is hard because if someone says, okay, so we always talk about treatments at the end of these things. So the treatment is there is no treatment if you keep them in.
Wow.
So kind of that's where it becomes difficult because
the cause is always there.
Yeah, exactly. So you could do all the work you can to try to help a little bit, but nothing's ever going to be fully resolved. But, then so you've got to take them out. And then, like you said, you've got to, what if they don't resolve and you've got them out? So it's a really hard one. It's a really hard one to do.
So as a naturopath, how would you support recovery from this if you had to? There's no real treatment and while it's in there?
There's no real treatment.
Say you have explant surgery.
Yeah.
What would you do to support them? So
I guess, and even if you're looking at having surgery, you're going to have surgery, we can even start a little bit of sort of support there. So supporting detoxification pathways and things like that so that because you've got to remember that, as we talked about, even the silicon bleeding into the tissue, there's a lot of other things that, is there molds, is there, as we talked about, bacteria and things like that. So it's sort of a bit of a detox, open up those detox pathways to help your body a little bit to sort of start to release some of this stuff. So when you have them removed, everything's opened up to sort of allow some of these toxins to get out. So glutathione is one we talk about all the time for detoxification.
That's a triamino acid that's got glycine, glutamine and cysteine in it?
Yep, exactly. Yep. So very good. Not very good for you. It's very good.
Yeah, it's good for me.
Correcting you. Very good, Steve.
Oh, good. Yeah, I remember the 3 amino acids.
5 stars.
Glutathione, love it.
Glutathione. Liver support.
Yep.
Infrared saunas are really good for detox.
Ooh.
Really good.
Yep.
Binders, we use binders a lot. So binders are different. You can use citrus pectin, you can use charcoal, you can use
we used to use diatomaceous earth. Is that stuff still around?
Yeah, it's still a thing.
Activated, okay.
Zeolite, clinopinte, I think is another one.
See, I haven't treated someone for donkeys with this stuff.
Yeah, so they're good because they help to basically attract a lot of the toxins and pull them out of the body. Be careful with binders, because I've had clients that come to me and say, I take diatomaceous earth every day.
Oh.
It binds essential nutrients.
Yes. Yeah,
so
you don't want to do it every day.
You don't want to be taking binders every day. There's specific purposes, but because you'll end up with nutrient deficiencies.
Of course you will.
Binding all your nutrients up. So
now, a lot of crap goes in your lymph system, which is the thing that goes back to your heart and pumps in your body. So what do you do to support the lymph?
So you really want to work on that lymphatic support, lymphatic system. So a lot of herbs. There's lots of different herbs you can use for lymphatics. So your burdocks, your cleavers.
Poke roots, they're still around?
Yeah, poke root.
Yeah,
poke
good.
root's still around. So infrared saunas again for lymphatics, dry skin brushing. Look, there's not a huge amount of science on it, but I think why not chuck it in there anyway? Because some people, it's helping the circulation anyway. It gets things moving. Rebounding. There's little rebounders for lymphatic flow.
Mini trampolines,
Yeah, mini trampolines. So you want to get that lymph flowing because, as you said, that's where a lot of the toxins can sort of build up. So get that.
Tony Robbins does the rebounding a lot. And I saw him in one of his video once. Yeah, I just thought that's
I know he's got his little plunge pool out the back that he jumps in every morning.
He's doing all right for himself, isn't he? He can build his own plunge pool.
Exactly. Yeah, it's a nice one too. Yes. So gut support because the gut's always involved in everything.
Yep.
So we want to get the gut support.
Now, oxidative stress. What do you use to reduce oxidative stress?
So we want to do lots of antioxidants as well, obviously, because any sort of inflammation creates oxidative stress, so we need to address that. So, we've talked about all that sort of, alpha lipoic acids, we've got the vitamin C's, vitamin E's, all the anti-inflammatory and antioxidant type compounds. Work on the immune system. If there is an autoimmune condition still present, then you really want to be trying to modulate the immune system and try and get that back into balance because sometimes it can get stuck, and that's what happens with autoimmune conditions. You want to try to rebalance that.
Sure.
So there's some of the things you can do. And then psychological support because you get them taken out. Obviously, you've taken away – I mean, the women put them in obviously aside from reconstruction surgery. I'm kind of putting the reconstruction
I know what you mean.
aside for now, I guess, because sometimes
it's like a necessity.
Yeah, definitely. But psychological support, because these women have got them for a reason, whether it be low self-esteem, whether it be something or other body image issues. So now they're gone again. So that underlying, driver might still be there. So psychological support really important. So you're working on sort of that underlying reasons as why you felt that you needed to get them or you wanted to get them in the first place. Was it for you? Was it for somebody else that you wanted to get them? We don't know. So I think that's really important.
That's a really good point, actually.
Yeah, because I think sometimes that can be forgotten about. So, you know, if you felt like you needed to enhance yourself, why? And I'm not saying there's anything wrong with it. I'm not saying that you shouldn't. I'm just saying, but why?
So, Nic, okay, let's say you're considering breast removal and you're worried about how they'll look after it. What else can women do surgically to maintain the appearance of healthy breasts?
So there's something called mastopexy, Steve.
Oh, what's that?
So that's when they sort of like cut away, take the loose skin off and pull the breast up a bit, and that makes them sit a bit nicer when you're not having to put implants back in there again. So that's a pretty common procedure to get done if people have had explant surgery.
So it's not the end of the world. What we're trying to say is after there's things you can do.
There's definitely things they can do now to reconstruct the structure without having to put.
My friend had this procedure.
Okay. Yeah, I think this is relatively common.
But there's another procedure they can do by filling it with fats.
Yeah, fat grafting. How cool is that?
Now that sounds promising.
Yeah, because
yeah, you kill two birds with one stone.
That's it. I was going to say the same thing.
It's like, normally you get the liposuction and you put it in a jar and chuck it in the, but actually taking that because it's your own fat.
Yeah.
You're not going to get an autoimmune reaction to that.
That's right.
Does it last? I don't know. I haven't researched this.
Yeah.
It's not my area of expertise but because fat can be reabsorbed, of course, by the body and utilised as that. I guess all breast tissue can anyway.
Well, I guess so.
You see a lot of, in our industry, a lot of women bodybuilders who become very, very lean, their size diminishes dramatically.
Yes, it does. I lost a lot of weight when I competed. Yes, it does.
You want to talk about that or not?
No, well, you do. You just lose. You lose your body fat.
Yeah.
So breast tissue is mainly fat. So that's why you lose weight, and that's another thing. A lot of women get breast implants because they lose a lot of weight. So and they might have had relatively. Stop doing that. They've lost a lot of size in their breasts as well. So therefore they can get a lot of loose skin and things like that. So or they can just be a lot smaller. So yes, because they are mainly
amazing.
Yes. So and as we said at the beginning, any implant, anything that you put in your body, you can have a reaction. You can have issues. So
all right. So what other implants are you talking about here?
Well, as we said, buttock implants, calf implants are a thing. Steve.
I'm looking at that going, I'm tempted.
Yeah.
And buttocks, my butt's shit. My pecs are shit. Calves are shit.
Calves.
I get it. I totally get it. I wouldn't do it.
Yeah.
I'm 55. I'm married. I don't, but I get it. I know why they do it.
Yeah.
Because you walk in there with your skinny little calves, walk out with nice chunky fat calves. I'm serious. It's a pretty good, it's like an idea. But what other implants can cause it, apart from the buttocks ones and that sort of thing?
So cerebral spinal fluid shunt systems.
All right. So if you've got too much cerebral spinal fluid floating up there, this is a procedure you can use for migraines.
Yes.
And all sorts of other things like that, where they basically, mitigate the pressure of a cerebral spinal fluid.
Yeah.
And I totally get that. And that's a necessity for some
and that's
people.
it. And some of these are a necessity. Cochlear implants, again.
You've got to be able to hear.
Yeah, exactly.
Yeah.
Birth control, like IUDs, Steve. You can even have issues with IUDs, maybe obviously not to the degree that you can have with but I've had women come to me that have had IUDs that have been covered in E. coli and things like that. And lots of other bacteria.
E. coli is a bad bacteria and it shouldn't be in your uterus.
No, yeah. The copper coils, attracts bacteria.
It does.
So a lot of them get covered in bacteria, so different
So does
things.
Iron, by the way, for those who are playing along at home. Yep.
That's why with iron and you get bacterial infection, your body takes all your iron away so it doesn't get eaten up. Metal on metal hip implants.
Oh, my God.
I'm going to try and say this one. Phakic intraocular lenses.
Yep. They're fake lenses.
Fake lenses.
Yep.
Surgical mesh, as we said, so for hernia repair, things like that, which is not an uncommon thing. It has to have it. Body modification implants, as I said, so the things just stick under you. And even piercings. So if you see someone that has a lot of piercings.
I'm looking at someone who's got 2 piercings.
I had more. I did have more piercings, yeah.
Did you?
Yeah. I had one more piercing. It's gone now. The dog ripped it out.
The dog ripped it out? You vicious killer.
Yeah, my vicious killer dog ripped out my... I had a navel ring.
Oh, I was going to ask where it was, but I thought, no, that's rude.
He jumped up on me and he nips at me. Oh, he's just playing. But he nipped and he grabs.
German Shepherd attacks you.
He rips out my ring. But yeah, but even piercing. So someone that has, like multiple, I'm talking 20, 30 piercings. A lot of people do now. And I know they're metal, but it's still a foreign body. Your body can still react to certain ways. And we won't go into, there's a whole nother issue with piercings. We can talk about it. I don't
want to think about those other piercings. I know there's many areas you can do it.
Well, we can talk. I mean, this is less scientific, but meridians. And there's a thing about with you're blocking the meridian, you're cutting the meridian with a lot of your Chinese medicine, meridian.
It's Chinese medicine. It's where energy lines go through your body.
So you're blocking that energy.
And legitimately works. This is not like I don't know how it all works, but when I was doing my master's, we had to do a project on research in an area you didn't know much about, and I was fascinated with all this. So I did research on acupuncture, and there's so much data on it.
Yeah, it's fascinating.
That it actually literally helps with things like osteoarthritis and stuff. And I didn't think that was I thought it was good for rebalancing something a bit, but it really helps with physiological conditions. I wasn't surprised because I graduated with a few acupuncturists and they'd always be popping needles into us. But
anyway, we digress to something
different,
else.
But piercings.
But any implants can definitely have impact. So we're talking specifically about breast implants today, but anything, if you've had implants, whether surgical implants, you're having issues. That could be part of it. And obviously, if you have some of these implants, you have to have them, so you're going to have to work around it. But getting back to breast implants, if you having a lot of unusual symptoms that just don't seem to match up to anything and they've come out of the blue and you can't sort of pinpoint what's going on, and you do have breast implants or have had them in the past, that could possibly be a driver. So that's something to maybe think about. I know when I see clients, a lot of times I will ask if they have any implants, if they have had symptoms for a long time but not anything definitive. And if you do have them and you're getting a lot of these issues and then you're looking at getting them out, then, that's probably a good idea. And there's definitely things you can do.
About 1 in 20 women get this implants, which is a lot. Yeah. And I don't know what percentage of them are doing for aesthetics and some are reconstructive, but I would guess most are aesthetically doing it.
Yeah, I would say a lot of them are, yeah.
And it's fascinating.
It is, yeah.
And it's now all coming out after 60-odd years.
Yeah. Yeah, and I mean, we did this initial breast implant illness podcast was done quite a few years ago. It's not up anymore, but you think, that was quite a long time ago. But I think that there seems to be more women getting them now. If you are having some health issues and you can't figure out what's going on, then it could possibly be something to look at. But I think we wanted to just highlight again that it still can be quite a significant problem. And it needs to be probably talked about still to this day.
And if you're having problems, see your doctor and see someone like Nic who can help you with this, because this can be serious. This can be very serious.
It can be. A lot of these women are so debilitated, so you want to get your life. They want to get their life back. So
all right. Well, we better wrap this up because time is time.
Yeah.
But we'll see you all next week, Nic.
Yeah.
See you,
Steve. Thanks, guys.
If they're green, what do I care? It's green. It's like...
That's what I love about you, Steve. There's no pretenses there.
I don't care. I can't feel a thing to care.
Yeah.
I want to cut. Nice.
You probably got bigger boobs. You got pretty good boobs, Steve.
I didn't care. Sure, I was working with her. But after the operation, the way of, how do I put this politely? Shit. How am I digging my...
Steve.
No, it's just... I could read that, but I had to say it. I'm trying to be positive. But she...
Oh, my God, the train's left the station and we can't stop it.
There was a reason she did it.
Cool.
Sorry, I had to... Cheeky girl.
All right, cool. Yeah, no, I'm gonna laugh. Oh no, you started the wrong. Okay, no, I'm good. I'm good. I'm good. All right. So
But you can't
We
not
started
look.
on a high and we're finishing
I
on
know,
a high.
but it's not